Hello everyone. Today I am going to tell you about what is high blood pressure and signs, symptoms and causes of high blood pressure. What is high blood pressure? Narrow blood vessels create more resistance to blood flow. The narrower your vessels are, the more resistance there is and the higher your blood pressure will be. Over the long term, the increased pressure can cause health issues including heart disease. What are the categories of blood pressure? 5 categories define blood pressure readings for adults. Healthy blood pressure. A healthy blood pressure reading is less than 120 by 80 mm of mercury. Elevated blood pressure. This is the systolic BP is between 120 and 129 mm of mercury and the diastolic BP is less than 80 mm of mercury. Stage 1 hypertension. The systolic BP is between 130 and 139 mm of mercury or the diastolic BP is between 80 and 89 mm of mercury. Stage 2 hypertension. The systolic BP is 140 mm of mercury or higher or the diastolic BP is 90 mm of mercury or higher. Hypertensive crisis. The systolic BP is over 180 mm of mercury or the diastolic BP is over 120 mm of mercury. Blood pressure in this range requires urgent medical attention. What are the symptoms of high blood pressure? Blood spots in the eyes, facial flushing, dizziness, severe headache and bleeding from nose. What are the causes of high blood pressure? So I will divide it into essential or primary and secondary hypertension. So now the causes of primary hypertension are genes. This may be from gene mutation or genetic abnormalities inherited from your parents. Age. Individuals over 65 years of age. Race. Black non-Hispanic individuals have higher incidence of hypertension. Living with obesity. High alcohol consumption. Women who habitually have more than one drink per day and men who have more than 2 drinks per day may be at an increased risk for hypertension. Living a very sedentary lifestyle, that is, lowered levels of fitness have been connected to hypertension. Living with diabetes and or metabolic syndrome. High sodium intake, that is more than 1.5 gram per day. Now let's know the causes of secondary hypertension. These are kidney disease, obstructive sleep apnea, congenital heart defects, thyroid disorder, side effects of medication, use of illegal drugs, chronic consumption of alcohol, adrenal gland disorders, certain endocrine tumors. Thanks for watching.